You know, when we talk about eye health, it can feel like we're kind of in the dark, no pun intended.
Right.
And you've brought us a question about cataracts and glaucoma,
Yeah.
and it's something that seems to trip a lot of people up.
Yeah.
Understandably so. They seem similar at first glance.
Hmm.
But today we're going to try to shed some light on these two common
Yeah,
conditions. And
absolutely.
trust me,
Yeah.
understanding the difference is crucial.
Absolutely. We're talking about the health of your eyes, after all.
Uh,
And the article that you shared points out a pretty startling fact. Millions of Americans are dealing with either cataracts or glaucoma.
Millions. Wow. That's way more common than I realized.
Oh, yeah.
It's a good thing we're diving into this then.
Yeah, it really is.
Yeah.
Especially when you consider that the risk for both of these conditions really starts to climb after age 40. And here's another eye-opener from the article. For some reason, glaucoma seems to be more prevalent in women, around 60% of cases.
60%. That's a pretty significant difference. I wonder what's behind that.
Right.
Makes you really stop and think.
Yeah.
Well, one thing's for sure, whether you're a man or a woman, both conditions can be a little sneaky in the early stages, right?
They can be.
They share some common ground when it comes to symptoms, don't they?
They do indeed. Both cataracts and glaucoma can cause blurry vision difficulty, seeing at night, just an overall dimming of your sight.
Yeah.
It's like turning down the dimmer switch on your vision.
So someone might just think they need a new glasses prescription.
Right.
That's why those regular eye exams are so
Yes.
important, especially as we get older.
Exactly. Catching these conditions early can make a world of difference.
Yeah.
Now, while those initial symptoms might seem similar, the root cause of each condition and what's actually happening inside the eye are totally different.
Okay, let's unpack this.
Okay.
The article says it boils down to location.
Think of it this way. Glaucoma affects the optic nerve, which is basically the high-speed cable that transmits everything you see from your eye to your brain.
Wow.
Cataracts, on the other hand, cloud up the lens of your eye. Imagine trying to look through a camera lens that's got smudges all over it. That's essentially what's happening with cataracts.
So one is messing with the wiring and the other one is messing with the lens itself?
You got it.
No wonder the symptoms and treatments are so different.
Right?
Speaking of symptoms, the article mentioned that cataracts are painless and develop slowly, but glaucoma, that can be a whole different story.
It can indeed. Cataracts tend to creep up on you. Gradually, you might not even notice them at first. Glaucoma, however, has the potential to be a much more urgent situation. There's a type called acute angle closure, glaucoma, and it can strike suddenly and, importantly, painfully. We're talking severe eye pain, headaches, even nausea. It can be a real medical emergency.
Wow, that sounds pretty scary.
Yeah.
So with cataracts, you might just think, oh, I need to update my glasses.
Right.
Whereas with this type of glaucoma, you'd know something was seriously wrong.
Exactly. And that difference in how they develop that urgency factor plays a big role in how each condition needs to be treated, wouldn't you say?
Absolutely. So let's talk about that. How do these conditions actually affect what you see? It seems like cataracts are more of a blurring, dimming issue, while glaucoma can actually lead to blindness.
That's a good way to put it. With cataracts, you get that cloudy, blurry vision. You might even experience double vision, as the article mentioned. Untreated glaucoma, on the other hand, has the potential to cause irreversible blindness because of the damage it can inflict on that optic nerve.
Irreversible blindness. That's definitely a wake-up call if I've ever heard one. It makes you realize how important those regular eye exams really are.
Could agree more. And that difference in severity, how much damage each condition can cause, ties directly into how quickly they need to be treated. The article makes it clear that cataract surgery can wait until it's truly interfering with your life. But glaucoma, that often requires immediate action to prevent further damage.
It's like the difference between having a small leak in a pipe versus a complete burst.
Yeah. Exactly. You want to catch it and fix it before it causes major damage with cataracts. You might have some time to plan to think about your options, but with glaucoma, especially acute angle closure, glaucoma time is of the essence you need to stop that damage to the optic nerve in its tracks.
It really highlights just how different these two conditions are, even though they might seem similar on the surface.
Right.
And that leads us to the treatments themselves, which, if I'm remembering the article correctly, are also pretty distinct.
You are right. Treating cataracts is usually pretty straightforward. We're talking surgery to remove that clouded lens and replace it with an artificial one. Glaucoma treatment, however, has a broader range of options depending on the individual case and the type of glaucoma we're dealing with.
So listen, what kind of options are we talking about here?
Well, surgery is always on the table, of course, but we also have laser treatments, different medications like eye drops, even implantable devices that help regulate the pressure inside the eye.
It's amazing how many tools are available these days. So with cataracts, it's mainly about replacing the lens, but with glaucoma, it's more about managing the pressure and preventing further damage.
You got it. And here's another key difference highlighted in the article. Blindness caused by cataracts, no matter how severe, can actually be reversed with surgery.
Wait, really? That's incredible. So you can potentially get your vision back completely.
It's true. It offers real hope for people dealing with cataracts with glaucoma. Though while we can't reverse the damage that's already been done, treatment is all about preventing further vision loss.
So it's like hitting the reset button with cataracts,
Yeah,
but more like damage control and maintenance with glaucoma.
you got it. And that's a really important distinction to keep in mind.
It's fascinating how two conditions that share some initial similarities can have such vastly different outcomes and treatments. It really emphasizes the importance of getting a proper diagnosis and understanding what you're dealing with.
I completely agree. Now, there's another interesting point in the article that I wanted to touch on. It's about the relationship between cataracts and glaucoma. Because while cataracts don't actually cause glaucoma, they can increase your risk of developing it.
Wait, what? That's like saying eating a cookie doesn't cause a toothache, but it might make you more likely to get one.
Right.
How does that work?
That's a great analogy, and it all has to do with the anatomy of the eye. Remember how we talked about cataracts being a clouding of the lens?
Right, like smudges on a camera lens?
No, exactly. Well, as that clouding gets worse, as that smudge gets bigger, it can actually start to push on other parts of the eye, like the drainage system.
Oh, I see where this is going. So it's like clogging up a drain pipe.
Precisely. And when that drainage system gets blocked, it can lead to a buildup of pressure inside the eye. And that, my friend, is one of the hallmarks of glaucoma.
So it's not that the cataract itself is causing the glaucoma, but it can create the perfect environment for it to develop. It's like a domino effect.
Exactly.
So it's not just about addressing the cataract itself, but also being aware of these potential chain reactions.
Exactly. It's a secondary risk factor that people with cataracts, especially those needing surgery, should definitely be aware of.
That makes a lot of sense. Now, this next question might be pushing our luck, but what happens if you're unlucky enough to be diagnosed with both cataracts and glaucoma?
That's a great question, and thankfully the article does touch on that as well. Sometimes simply removing the cataract during surgery can actually alleviate the pressure enough to manage the glaucoma. It's like killing two birds with one stone.
Wow, really? So in some cases, cataract surgery can address both issues at the same time?
It can.
That's incredible, but I'm guessing it doesn't always work out that simply.
You're right. Unfortunately, it's not a guaranteed solution. Sometimes a combination of treatments is needed to effectively address both conditions.
Like, what other options are on the table in those cases?
Well, there are a number of procedures that can be used. The article mentioned a few, like endocyclophotocoagulation.
Hold on, say that again. Endo what?
Endocyclophotocoagulation, essentially it uses a laser to reduce eye pressure.
Ah, okay, laser eye surgery. Got it. That makes sense.
Yeah.
Anything else?
There are also drainage devices that can be implanted in the eye. Think of it like a tiny pressure relief valve having to prevent further damage. And then there's something called a microshunt.
A microshunt. What in the world is that?
It's basically a tiny tube that's inserted into the eye to help drain fluid and reduce pressure. Pretty amazing technology, right?
It sounds like something out of a science fiction movie.
It does, doesn't it?
But it sounds like the key takeaway here is that it's not a one-size-fits-all situation.
Right.
It's about finding the right combination of treatments for each individual patient. Right.
Absolutely. Every case is unique, and it requires careful consideration and a personalized approach.
This has been incredibly informative. I feel like I've learned so much already, but I always like to bring things back to what this all means for our listener for their eye health. What are the key takeaways here?
I think the biggest takeaway is the importance of early detection. For both cataracts and glaucoma, if you're experiencing any of the symptoms we talked about today, even if they seem minor, don't wait. Get to an eye doctor as soon as possible.
Absolutely. Don't wait until you're seeing double or having excruciating pain. Get those eyes checked regularly, especially as you get older. It's like going to the dentist. You might not love it, but it's better to catch problems early.
Couldn't agree more. It's much easier to address these conditions when they're caught early, and it's the best way to protect your precious vision. Now, the article we've been discussing focuses heavily on the medical differences between cataracts and glaucoma, the biology, the treatments, but it made me think, what about the impact these conditions have on a person's quality of life?
That's a great point. It's one thing to understand the science behind these conditions, but it's another thing entirely to think about how they actually affect a person's daily life, their ability to do the things they love.
Exactly. For example, how does the vision loss caused by cataracts, even if it's temporary, affect someone's ability to read, to drive, to even just recognize the faces of their loved ones.
That's a really good point. I can only imagine how frustrating and disorienting that must be.
And with glaucoma, the potential for permanent vision loss must have a huge psychological and emotional impact as well. It's something that we don't often talk about, but it's so important to acknowledge.
I think you've brought up a really important aspect of this whole discussion. The article gave us the what and the how, but now it's up to our listeners to consider the so what.
Exactly, because knowledge is most powerful when we can connect it to the bigger picture, to how it affects us as individuals and as a society.
Well said. So there you have it. Your deep dive into cataracts and glaucoma. We've covered the surprising similarities, the crucial differences, the treatment options, and even touched on the potential quality of life impact. It's like that old saying, an ounce of prevention is worth a pound of cure. It's so true when it comes to our eyes.
Absolutely. And, thinking about the quality of life impact brings up another interesting point. The article briefly mentioned that both cataracts and glaucoma can make it difficult to drive, especially at night.
Oh, right. Because of the glare and the halos people often experience with these conditions, right?
Exactly.
It's not something I would have immediately thought of, but it makes total sense.
Exactly. And for many people, driving is essential. Getting to work, running errands, staying connected with loved ones.
Yeah.
Imagine how limiting it would be to have to give that up or rely on others.
That would be a huge adjustment. It really puts things into perspective. It's a good reminder that even if treatments can address the physical aspects of these conditions, there can be these ripple effects on our daily lives that we need to be mindful of.
Precisely. And it highlights the importance of having open and honest conversations with your doctor. Don't be afraid to share how these conditions are affecting your day-to-day life, even if it goes beyond the purely medical aspects.
Absolutely, because it's about more than just seeing clearly. It's about maintaining your independence and your quality of life. Well, this deep dive has really opened my eyes to the complexities of cataracts and glaucoma, and I hope our listeners finding it just as insightful. It's been fascinating to really dissect the science behind these conditions, but then to take that next step and think about the human impact, the day-to-day realities. I think that's what makes this deep dive so valuable.
I agree. It's about connecting the dots between the medical information and what it actually means to live with these conditions.
Exactly, because knowledge without context can feel a bit abstract. But when we understand how it impacts our lives, our choices, that's when it becomes truly powerful. So as we wrap up this deep dive, I want to make sure our listener has all the tools they need to advocate for their own eye health.
Absolutely, and I think it boils down to a few key things. First and foremost, don't underestimate the importance of those regular eye exams. I know it's easy to let them slide, especially when life gets busy, but they are so crucial for catching these conditions early.
It's like that old saying, an ounce of prevention is worth a pound of cure. And it's true for so many things in life, especially our health.
Exactly. And second, don't be afraid to ask questions. If you're experiencing any changes in your vision, no matter how small, speak up. Your doctor needs to know what's going on in order to give you the best possible care.
Absolutely. Sometimes we brush off little symptoms thinking, oh, it's probably nothing, but it's always better to err on the side of caution, especially when it comes to our eyes.
I couldn't agree more. And finally, remember that knowledge is power. The more you understand about these conditions, the better equipped you'll be to make informed decisions about your health.
Well said. So to our listener out there, we hope this deep dive into cataracts and glaucoma has been enlightening and empowering. Remember, you're not alone in this. Millions of people are dealing with these conditions, and there are resources available to help you navigate the journey.
And never hesitate to reach out to a qualified eye care professional if you have any concerns. Your vision is precious. Take good care of it.
Beautifully said. Until next time, keep those questions coming and we'll keep diving deep.